Magnesium versus melatonin. Which one is going to finally eliminate your insomnia and give you a great night's sleep? Well, in order to answer that question, I think the best way to explain this is to explain it in two different case scenarios because everybody's going to be different. So case scenario number one, which we'll call this person A, was a patient of mine that was suffering with going to sleep, a person that was suffering falling asleep. So every night she would try to go to sleep and sometimes she wouldn't be able to fall asleep until 3 to even 4 a.m. And then when it got really bad, she couldn't even fall asleep at all. And therefore the next day didn't get any sleep. And that would definitely impact her energy, her focus, and she really was suffering at work, and it was getting so bad that her boss was noticing it, getting to a point where she could almost lose her job. Not only that, on top of that, she was definitely feeling more irritable, especially against her spouse, and just more moody, and this just didn't help at all with her life situation. And it was getting so bad that because she was not getting good quality of sleep, it was definitely impacting other aspects of her health, especially her cardiovascular health. So when I was meeting with her and talking with her about the situation, I come to find out that part of her job was to travel a lot. And she would travel to different time zones and back and forth. And this definitely didn't help with her situation because when you're having to travel in different time zones, that's going to really mess up your circadian rhythm. And when you mess up the circadian rhythm, it's going to make it more difficult to be able to fall asleep. So one of the important things with sleep is when you look at the brain, there's a particular part of the brain that helps with sleep and releasing a hormone known as melatonin that's released in the pineal gland. When that's released, then we can fall asleep. But there's some important things that have to happen before that does happen. And that has to be having it being dark. And we live in a society where we have screens in front of our face, and she was definitely doing this every night. She was in front of her screen watching stuff or watching TV or looking at her phone. And there was definitely no question of why it was so difficult for her to fall asleep because she wasn't allowing her brain to be able to naturally produce melatonin to be able to help her fall asleep. But also the big problem was that she was traveling all the time, and that really was messing up her circadian rhythm. So once I saw this, we need to help reset that circadian rhythm. One of the simple ways of doing that is using something like melatonin because melatonin will help reset the circadian rhythm. If you're dealing with any kind of jet lag, or if you're someone that also does look at screens all the time at night, you might need to supplement something like melatonin to help your brain to finally start producing it on its own. So what I did with her is you start at a very low dose of melatonin, something like 2 milligrams a day. Then you bump it up to 2.5 to 3, and eventually up to 5 if you need to. And the reason you want to do this is you want to slowly do this because sometimes you don't need the high amount. It just really depends. And this helps us kind of gauge when you finally hit that moment when you can actually fall asleep. And that for her, in her case, that was about 4 milligrams a day at night. Once she was able to do that, then we worked on other things to replace this melatonin, which was definitely getting rid of the screen time at least 2 or 3 hours before she went to bed. And then also talking to her boss about the craziness of her schedule of traveling so much and to be able to reduce on that. Sometimes we have to identify sometimes what are the external stressors, such as possibly the work environment. In this case, it was her traveling all the time. Melatonin can, yes, help reset that, but it's never going to be the long-term sustainable solution. I usually don't want people to be on it more than 3 months at a time because the whole purpose of melatonin for supplementing it when you're using it for sleep is to just reset the circadian rhythm and then naturally doing it on your own with light therapy, as well as making sure you don't expose yourself at night with light. Another amazing way to improve your sleep is if you just subscribe to this channel so you don't miss out on any ways to help improve and optimize your sleep, optimize your mind. Now, the second case scenario, we'll call this person B, was a patient of mine, very different. Not only was he having a hard time falling asleep, but he also was having a hard time staying asleep. And when I got to talk to him, it wasn't just because he had a hard time falling asleep and staying asleep. I also found out that he had very high anxiety. He was stressing and ruminating at night, and he would wake up in the middle of the night and he would stress out about it. But also on top of that, he was dealing with restless leg syndrome, which was keeping him up at night. Now, this individual did try melatonin. He tried a lot of different sleep aids. He did try lots of different medications to help him with his anxiety. The doctors told him that will help with his sleep. He tried it all, but it wasn't doing anything for him. So whenever I see this, I have to think differently because if melatonin didn't work and all these different sleeping aids didn't work and the medications weren't working, then there's probably a more internal problem that's going on here that's being missed to really identify what is the root problem for this particular situation. Also, the fact that he also had restless leg syndrome made me think, okay, there's a possibility of a micronutrient deficiency that could be contributing to this, but also could be contributing to his high anxiety that's keeping him up at night. So I ran a full micronutrient panel panel to identify, okay, what could the possible micronutrient deficiencies here. And sure enough, his magnesium levels were significantly low. And whenever that happens, this can be a major reason of why he is having restless leg syndrome, but also can contribute to his high anxiety. So what I decided to do is to put him on 2 different types of magnesium. One, at night, I had him take Epsom salt baths. So there's a type of magnesium that's easily absorbed through the body when you're taking a bath. It also really helps calm the nervous system. It also relaxes the muscles to really help with the restless leg syndrome, but also help him feel calm at night. And then on top of that, I gave him magnesium citrate, which is also really great for relaxing the nervous system, but also getting the magnesium in and easily absorbing it to his nerves and muscle tissue so that the restless leg syndrome could be maintained for him. And certainly within just a few days, he was able to really eliminate the restless leg syndrome, so that helped him actually stay asleep. But more importantly, he was able to be more relaxed at night, and that made all the difference for him to fall asleep, but also stay asleep and help him sleep just like a baby throughout the night. So it's really not as simple as it always can be of which one is better for you, but identifying what is the big reason behind your sleep situation. So if you're like somebody just like person A, where you can't fall asleep at night, or you're traveling all the time, or you also are not practicing good sleep ergonomics, where you're watching screens all night and not helping your body release melatonin, then you might be needing to use something like melatonin. Or you're like also person B, that could be that you can't fall asleep or stay asleep and you're stressing at night and you're having restless leg syndrome. So maybe magnesium might be the one. But a lot of times magnesium isn't going to be the one when it comes to helping with stress. Stress is the big one that is going to impact your sleep significantly. And so there's some other things that can help with reducing the stress, helping you relax it more to help improve your sleep. And that would be things like ashwagandha and also L-theanine. Some of them are the great ones that you could be using for, but which one is the best? Which one's the best one to use? Well, you should watch this video next where I talk about the differences between L-theanine versus ashwagandha. So watch this video next to help you out on your health journey.